Thank you, Azuka. You saw the press communique on the 9th of November from Africa Union. It's actually 17 countries. They were waiting for 15 countries to deposit the instruments. So the 17 countries have done so. Another 24 countries have signed the treaty, but have not deposited the instruments at the Union. The 15-country mark has been reached. So I think this is the year of celebration. It is actually the inflection year for Africa and supply chain. It's an incredible year. This is the time where I believe we have passed the first hurdle, and the system of setting up Africa Medical Agency is now going to be in place. You know, the Commissioner of Health, Amira El-Fadil, Michael Sidibe, Margaret Angama, and many others have worked very hard, and many people in different countries have worked very hard. So I believe we are at the most important inflection point. It's going to change the cost of healthcare. It's going to change availability of supplies. It's going to change intra-Africa trade from the 17% as we try to achieve what Europe does at levels of 70%. And the people who are in the healthcare system are going to take advantage of this. Manufacturing will change. All the stumbling blocks. We had 55 borders that made 55 obstacles of paracetamol moving from one country to the other. All those are going to be lifted. Imagine it's going to be 55 times easier. Like you asked earlier, how long will it take? That's a good question. I think member states have been asked to apply. Those who want to headquarter the agency, the letters are already out. I'm thinking 6 months to a year. They will have bureaucracy before it's announced. I'm hoping it's fast track, but I see light maybe by end of next year to have a structured and a functioning. Then the implementation may take 2-3 years. So in say 4-5 years, we will have a dramatic reduction in costs of supplies and a dramatic improvement in availability. First, let's begin that it's not easy, right? India has 1.3 billion people and Africa is similar, but India has one regulatory process. And here we have 55. So you know, when people start comparing, you have one law that applies to 1.3 billion. So using the same perspective, but have regions done it well? Have we tried ECOWAS, EAC, SADC? You know, they've been trying. When ECOWAS was being formed, you remember all the worries and scare, and now WAHO, which is present there, they're doing a decent job. I must say they've collaborated, they've come up with some things. So look, let me just say that it is a long-term process, but a journey of 1,000 miles begins with the first step. And I think we are talking about our future generations. That's why when you hear MDGs and SDGs, we've come with our own Agenda 2063, and we are being realistic. You can design something in Washington, DC or in Geneva for Africa, but we in Africa must design our own plans. Who set those targets for us? Who decided that this is what we have to achieve? Who decided that that's what we're going to achieve? And this is what we're going to be measured with. It's now Agenda 2063 with 20 goals. If you've seen the 20 goals of Agenda 63, it's a 4-step process. The foundation is 5 years between now and 2025, right? From 2025, we have every 10 years to measure where we're going. And all this takes a process, including Nigeria, Ghana, duties. Every country is a sovereign state. If you remember, they were all planning to become prosperous. They're all thinking of what they have as their own model. And now to start balancing, it's going to be a journey. Let me use an example. We used to charge in East Africa $4,000 for a permit of a nurse and a doctor working for 2 years across the region. It took the regulators to come together and understand that if we waive this, health will become stronger in the region. Why should I, as the hospital owner, pay $4,000 for a doctor coming from Rwanda, or vice versa. The regulators need to change their mindset from a fee service making organ to a service provider organ. Regulators in our country sometimes need a paradigm shift. That's the problem. It's the money that they're making, whether it's duties, whether it's revenue authorities, that mindset needs to shift, and it's shifting. So when the regulators in East Africa came together, they harnessed this and they waived the $4,000 permit. Now, health workers are moving freely between 3 countries without employers needing to pay $4,000 for a permit. It's opened up employment in a dramatic way. The nurses could work in any country rather than being restricted of a certain passport that you hold, which means that the tropical diseases that they are treating, they can treat in any one of those neighboring countries. Look at now the railway development levy or the duties in Uganda and Kenya. They are not harmonized at the moment. IDF, which is exactly what you're saying. With AMA, I think slowly all these will dissipate and the bigger picture of access and availability of medicines will come in place. So my only point, I think, Azuka, to you, that this is a journey. We've got to start. The challenge will be, of course, the bureaucracy, a high-level bureaucracy like any other systems we've had. But we shouldn't stop that. We as partners and stakeholders must assist Africa Union and its structures to be part of the solution and not part of the problem. It's a great opportunity. Devices, 17 years of HIV/AIDS, we still don't make our own tests. You know, it's a bit of a concern. Everything we buy is from outside. Every test, everything we do, RDTs we buy from outside. In fact, even glucometers, every glucometer for every diabetic patient on this continent we buy from outside. Every strip for checking sugar is from outside. Now, we got so lazy, and I think pandemic was the biggest wake-up call. It really gave us a shaking. So I think the biggest wake-up call for Africa has been the pandemic, that now wake up from slumber. Too much sleeping to the highest extent, that just because China could supply you and others could supply you, you just use your dollars to buy things. It's now time to change and make these diabetic stuff, devices, ECGs ourselves. When the borders are shut, what are we going to do? Sit there and say, please give us PPEs because we can't protect our doctors and nurses, they'll die? Come on, slumber is over. Okay, so I think the sleeping time is over, and we need to make our own devices, our own strips. We need to make our own ECGs. Now, there's a process, just like manufacturing. It doesn't get done in a day. Fill and finish, learn capacity, try and do things, but have the energy and an enabling environment. Now, maybe governments also need to change leadership, because they like buying. Once you become a minister and you are in government, procurement becomes almost a hobby. And for obvious reasons, procurement becomes a big thing. And that's been one of the largest problems on the desire to procure, and intertwined with some very funny contracts happening in all different ways. So that's where the biggest scams of healthcare come. So we need to get away from this, that I'm in my position as government and I need to buy. The more I buy, the more benefits. So that leadership transformation, plus the desire to create an enabling environment and making private sector realize that it's the right forum, there will be an amazing amount of investments in devices, in diagnostics, in manufacturing. Access to healthcare will be better. This continent is ready to shine. It just needs the tweak in that modeling of leadership.